In line with the NHS long-term plan, training hubs in South West London are working together to develop the primary care nursing workforce. In order for future nursing graduates to consider a career in general practice, we are working together to develop placement capacity in primary care. Our aim is that all student nurses should have the opportunity to experience practice nursing firsthand as part of their course.
We really need to increase placement capacity for student nurses in general practice. Student nurses are the workforce for our future. If student nurses have the opportunity to come into general practice and experience the environment, then they're going to be so much more likely to actually come and work with us once they qualify. We all know how difficult it can be to recruit into general practice, and with a reasonable percentage of practice nurses retiring in the next few years, this could only become a bit more difficult. If we get student nurses in now for their placements to experience all the opportunities that general practice has to offer, then they're going to be much more likely to choose general practice as a first destination career.
At Battersea Fields Practice, we've been delighted to support the placement of student nurses in general practice. We believe that providing placements for students is vital if general practice is to have access to a skilled nursing workforce in the future. We've worked in collaboration with other practices within our primary care network to provide a broad experience for students, giving them a good understanding of the scope of general practice nursing. Students have been able to use their existing nursing skills under supervision to undertake activities such as blood pressure monitoring, diabetes checks, and health promotion. Feedback from students has been very positive, and our nursing team has also benefited using their supervision and teaching skills and also contributing towards the nursing workforce of the future.
At the GP practice where I work, we recently had the opportunity to facilitate a student nurse for an 8-week placement, which was a thoroughly worthwhile and encouraging experience. She was brilliant. She was engaged and proactive, asking lots of questions and eager to learn. As the weeks went by, it was amazing to see her growing confidence and knowledge, learning about clinical guidelines, gaining clinical skills, thinking about holistic, patient-centred care. And we as a nursing team actually really thrived in facilitating her. We were able to share our knowledge, to develop our teaching skills, and to introduce her to the world of general practice.
When going into my GP placement, I really wasn't sure what to expect. I honestly thought it was going to be a bit dull, but I was very pleasantly surprised. So in a GP placement, I felt that the nurses had more time for me. They had time to explain things better, make sure I understood it. It's a bit slower paced, but it's a great way to learn that way. It is brilliant for outreach opportunities, and now that I've gone on in my studies and done other placements, I can actually look back and see how much knowledge I learned there that I've been able to take with me to other placements, and it's really helped me being able to develop within my nursing studies.